Ladies and gentlemen, friends and families and health professionals, this is Dr. Mohammad Adil from United Kingdom. I am a fellow of the Royal College of Surgeons of United Kingdom and Ireland, and I had 26 years of post-fellowship experience as a surgeon while working in UK, and 4 years of pre-fellowship experience while working in the Republic of Ireland prior to that. I wanted to keep you updated regarding my GMC case. Recently, I have been through medical professional tribunal hearing, which lasted for 3 weeks in Manchester from 13th of June until 1st of July 2022. I was alleged by the General Medical Council in March, April 2020 that I relayed some videos over the social media discussing COVID pandemic and its far-reaching effects on the public and the health of the patients. As a result of 4 anonymous complaints online to the GMC by 4 members of the unknown public members. Firstly, I was dismissed by the trust where I was working as a consultant general and colorectal surgeon in one of the tertiary unit in Manchester, without any charge sheet, any notification, or any disciplinary procedure, followed by suspension by the GMC for 12 months on 1st of June 2020. In a brief hearing over the Skype, which was further extended by the General Medical Council for another 12 months on 26th of May 2021. During the medical professional tribunal, which lasted for 3 weeks in Manchester, I requested to the GMC to produce those 4 complainants who had lodged initial complaint against me regarding my viewpoint of COVID pandemic. But GMC failed to produce any of those witnesses for the testimony to prove them as factual witnesses, which was totally unacceptable and unlawful. Similarly, GMC then alleged that my videos might have harm to my patients and safety of the public and might have damaged reputation of the medical profession, which was totally based on GMC assumption and supposition. Again, GMC failed to produce any witness, evidence, or any survey to prove its allegation that my videos had harmed any of my patient or member of the public. Medical professional tribunal were requested to order GMC to produce those witnesses to testify them to fulfill the course of justice, but my application was rejected by the chairman of the medical professional tribunal for unknown reasons, which is totally unlawful. In the determination on the final day, the chairman and the members of the medical professional tribunal concluded that I had no clinical or patient-related issue, and I had no health issue or any other issue whatsoever. But they suspended me for further 6 months with the presumption that I am risk for the safety of the public, which is totally bizarre. If I'm not risk to my patients and public for 30 years of unblemished record while working in UK, how could I be dangerous to the safety of the public? Which doesn't make any sense to me at all. It looks totally unfair, discriminatory, and miscarriage of huge injustice and victimization by the GMC as well as by the Medical Professional Tribunal. My legal advisors, PGH Law, Mr. Phillips Highland, and my barrister, Mr. Francis Hall, have taken my case to the High Court for justice against the unlawful dismissal and extraordinary abuse of powers by the General Medical Council to suspend me for 2.5 years, which has been extremely damaging to my reputation, my career, and to my family and their livelihood because of loss of my job and my income. We have seen extremely difficult time during these 2.5 years without earning a penny in UK. I have full faith and trust to the high courts of the United Kingdom, which are famous all over the world. And I expect that justice would be shown and done to me and my family who have been through devastating circumstances because of my sudden dismissal, suspension, loss of job and income, which caused serious stress and anxiety to my family and compromised education of my children. I would request to all of you who are listening to this speech, it's based on the truth, for standing with the cause of the humanity and public, to help me taking through this difficult time by generously donating your contribution through Just Giving crowdfunding source, which has been established by the company. And I'm grateful that most of you have already contributed generously. Your financial support will help me to pay not only for my legal expenses, for my solicitors and barrister and the court fee, but also if we lost the case, we will have to pay to the second party. I would urge to the higher authorities that the health professionals who have been suspended due to freedom of speech and expression should be reinstated, respecting their fundamental rights of expression of speech and freedom of expression under Article 10 of the Human Rights Act of the European Convention, which works for everybody to express its personal opinion, whether it's right or wrong. I am grateful to the high courts of the UK. They have already decided several cases of similar nature, and I expect justice for me and my family on that basis, and I'll be reinstated to get back to work. This is a time when millions of patients have been waiting for their investigations and treatment, especially the cancer patients who have lost their opportunity for early investigations and treatment. And also, millions of patients are waiting for their other surgery, including gallbladder surgery, thyroid surgery, and hip surgery, the cancer surgery, cancer of the breast, colorectal cancer, which I am specialist of both cancer surgical procedures, and the prostate cancers and lung cancers, and so many other diseases which patients are finding difficulty to get into the hospital at the present moment. There is a huge waiting list to clear. NHS admits that they will take at least 10 years to clear the waiting list in UK. But I would strongly suggest that all the experienced, qualified, and skilled surgeons should be brought in to help the historical shortage of the health professionals within the NHS who have either left the job because of their dissatisfaction at work, with the low income, or they were unhappy and were unrewarded by their hard work. I believe what Winston Churchill had said long time ago, all the greatest things are simple and many can be expressed in a single word: freedom, justice, honor, duty, mercy, and hope. Thank you ever so much for listening to me. And I'm most grateful for your kind contribution, donation, and moral and all sort of support. Just giving crowdfunding is underneath the speech, where you can kindly donate generously to meet up the expenses in the High Court. And I'll keep you updated regarding my forthcoming hearing in the High Court against the General Medical Council draconian decision against me and the other health professionals who have been dismissed, suspended, or erased from the register, with devastating effect on themselves as well as on their loving family. Many thanks. Bye for now.